I'm Mike Gannon from We Connect Dots. Last year, I connected actually 2 countries for digital health solutions. Connected NHS England and NHS Scotland for the SMS solution, email to SMS solution. So actually understand all of the complexities of the data governance and all of those things that people are thinking, or even billing the systems. We actually set up We Connect Dots to license and resell solutions that really solve big health problems. So you said before, don't reinvent the wheel. We're definitely not going to reinvent the wheel. So we've got things like 15 million people, cost with long-term health conditions, cost the NHS £7 in every £10. But when we look at the ability of where those people are, they're not actually in the hospitals or whatever. They're at home. So when we look at wearables and connected devices in the home, we basically need to get away from those silos of data and all of the different protocols. So you've got Fitbits, you've got your iWatches, you've got connected medical devices. And what we're going to do is provide a platform that connects today 250 of these via a single API. It will have Bluetooth and Android connections so that application developers can develop applications. And what the key thing is, it will take all that data that is siloed and it will actually standardize the data across all of those different protocols and provide actionable data for the clinicians, for the researchers, for the wellness programs, for all of those things. And the ability to have this data, as you said before, you've got these silos of data. Now you can actually have this data in a way that you can use the data. And thank you.
Can I go? Hi, I'm Stephen, and I'm here on behalf of Poffle today. So I'm representing ICE as well. So I'll give you our story of Poffle in 2 minutes, as quick as I can. Essentially, we started off with a massive piece of research. So we spoke to 1,500 people, roughly, up and down the country, and they varied from HCPs, GPs, families. It didn't really matter. Anyone who would talk to us, we spoke to. And the idea was to find out, do people want to do more for themselves? If so, what would that look like? So it turned out they do want to do more for themselves. They just don't know how, because they've been wrapped in services for so long. They told us, I want to be de-siloed. I'm being sick of being told to go to 6 different places for all my conditions. Why can't I just do it in one? And most interestingly for me personally, we had families. So there was kids, 14, 15, telling us they were worried about the future of health for their children they didn't even have yet. So that really was an eye-opener for me. So off the back of that, we developed Poffle, which stands for Pathways for Life. And it's all around citizens controlling their own data. It's encouraging people to set goals, track against them, and improve little bits of their life. So we started off with lifestyle. So we started with alcohol, healthy weight, healthy eating, and hydration. We've now moved into more long-term condition management as well. And it's all in one place. It's got aspects of community on there. So within each of the spaces, there's actually a support group within each to go. And that's whether you offer advice or whether that's you need advice. That's what it's there for. It doesn't really matter. I've actually done that really quickly today. So that's it. It's in a nutshell. Any more questions? I'm over there.
Hello, everyone. My name is Angel Salazar. I'm the CEO / CTO of AIDA Technology. We are developing an open innovation platform to bring together health professionals and technology developers. The idea is to shorten the learning curve of learning and applying new technologies on the technology side, and provide a knowledge-based repository for them and connect them with the health professionals, and translating, and as they were saying before, providing the bridge in the language, catalyzing the innovation between those two people. We're going to be launching private beta in July. We already have a network of collaborators with 20,000 health technology innovators in Europe and UK and the US. Obviously, we'd love to work with more people in Manchester, in the north. So if you want to approach us, there is a expression of interest form in our website, adatechnology.com. Thank you. And I have 40 seconds left.
Hi, my name is Gary Taylor. I'm the Business Development Director of a company called TWME8, just at the back on the left there. We've come today to talk about our new Equip quality improvement solution. Essentially, Equip is an app that frontline staff can run to record any quality issues as they encounter them. It does have features in there for classifying any of those concerns that they identify. They can theme them. Obviously, there's lots of reporting within there. I'm ex-NHS myself. Used to work for Northwest CSU, and I used to see a lot of concerns being raised between commissioners and providers when breaches occurred and things like that. This is there to help support particularly those relationships, identify the recording of information. But rather than just recording it, it includes uniquely collaborative workspaces, so you can pull multidisciplinary or multi-organisational teams together to address those quality concerns. It has been getting piloted with the LADAMS GP Federation in Lincoln. It's also been getting piloted with Aylesbury Vale CCG. LADAMS in particular have seen some real results because they've identified a lot of what were minor quality concerns, put teams together to address them quickly, and through being able to work together to redesign processes and pathways. For example, they've managed to reduce some of the care home readmissions in Hull from 30% to 12%, so it's got some real results. If you want to come and have a look, you're more than welcome. We've got some copies of the case study there as well. Thank you.
So I'm Ben Bridgewater. I'm the Director of CSC Healthcare in UK and Ireland Healthcare Strategy. I'm also an Honorary Professor in Ian Buchan's Department at Manchester University in Health Informatics. CSC is a big company, employs 50,000 people around the world. It has interests in defence, insurance, banking, retail and healthcare, of course. And we provide about 70% of all the PAS systems in the NHS, as well as about 70% of the lab systems. We are working with our client, who is at Trafford CCG, to provide a public health management solution for them. They've had some challenges. They've invested in services here, they've invested in services there, but it's all very disarticulated and wasn't visible to the patients who required to access them, and wasn't visible to the professionals who are trying to put patients into those services. So they've engaged us to put a care coordination centre, and we kind of see a passage from fragmented care, which is what currently exists, to coordinated care, which is what's required to actually make the best of the as-is situation, to move towards population health management, where you start to manage people better, to drive better care right across from cradle to grave for a lower cost for the health economy. So we're live with that. We've done all the heavy lifting around integrating primary, secondary social care data onto our platform. We top that up with a CRM platform, playing to the consumerism thing, which we've heard a little bit about before. We're managing the as-is situation around referral management, discharge management, and some of the coordinated care stuff already, and we're due to go live with a more comprehensive approach to managing coordination out of that. The benefits piece we've got on that is about trying to take 10% out of the planned admissions and 15% out of the unplanned admissions over the next couple of years, and we're well on track with that. Thanks very much.
I've got heels and a tight skirt, it's harder to get on. Hi, I'm Louise Rogerson, I work for Teleson, I'm just over there. We've got two things that we're working on. So one is an app called How Are You Today, and we developed that with Lancashire Care Foundation Trust. I'm a physiotherapist, and I really believe that there's a lot of information out there that we know about how people actually are from what they say. And it's not necessarily about the data that's currently used. So physiological measurements are useful, but it's an awful lot about how they feel. And that's what How Are You Today is based on. Our dream is to take a question bank that you can then pull across 4 or 5 questions which users have said they will tolerate, no more than that, and to then ask them those 4 or 5 questions every day. What we've done is we've made it their data. It's the patient's data that they're sharing with Lancashire Care, not the other way around, so they own it. That means they can then invite in other family members or other workers, anyone in their network, to share that information. And what we're trying to do is to take a good self-manager and let them manage themselves and share that information with the health economy, because it's all on AIMS, connected to the N3. But the other side of it is that we're allowing the family members to expand that network. So you've got not a good decision maker, like my mother. I'm a good daughter. I understand COPD. I can see my mum's having a bad day. I can phone her and say, Mother, it says take your prednisolone, not look at it. That makes a big difference, and that's what we're going to try and do. So the other side of what we're doing is home monitoring. We're going to take information from electricity meters, and we've got sensors in the home, and it comes through to an app, and it's empowering family members to take part in that, and we are ready to tip that data into anywhere that will have us, frankly. We're really interested in long-term analytics as well as the short-term information, so not just an alarm that says they're not right, but something that says she's up and about, boiling a kettle, taking on the microwave, and there is not a sensor in sight. So we're aiming at early doors for this lot. Thank you.